Hi, I'm Elizabeth Hess. I'm here with Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District. Hi, Julie, on this dreary day.
Hello.
Last week you said Champaign County was doing better, but we are not the only county in the area that you track. Are we still moving in the wrong direction in the surrounding areas?
We are. We've sort of plateaued, got a little better, got worse, or a little better again. So we are really hanging on the edge. But I will say that in Champaign County, our numbers are going up as well. And it's not the University of Illinois, it's community cases. So right now we're at 323 active cases with another 1,214 people being in quarantine. We have 7 hospitalized, and we've had the 28 deaths, as you know. And right now our regional positivity rate is 7.6. If we get 3 days of 8% positivity in a row, we will go into mitigation. Most of the state right now is in mitigation. I believe all of the regions except for 3 are right now. Us, the Springfield region and the Peoria region right now, but everybody's numbers are going up.
Talk about mitigation for a second. Does that mean we move back a step, or what exactly happens?
It would mean different rules for, well, if it's just the positivity rate, it would mean different rules for restaurants, bars, things like that. Smaller gatherings would only be allowed 25 instead of 50. And additionally, if our hospital numbers get below 20% a med surge capacity or ICU capacity, if there's only 20% capacity left, then that triggers specific additional mitigation. So it's, we're in a precarious position right now as we are moving into colder weather and flu season is upon us. I mean, luckily it's not in our community widespread yet, but it's coming. So it's very concerning. And, there are parts of the state that are doing even worse than us, quite a few. And then there are certainly many states that are doing worse than Illinois. So it's just not a good time right now. We're moving into what we've always known would be the most concerning and the most dangerous part. And I had certainly hoped that we would have got some kind of national strategy by now to where we would be at least going into the winter with way lower case numbers and way lower deaths and way lower hospitalizations.
First, the cities were hit hard, and now I'm reading that the rural areas are also being hit hard. Now the wave is hitting out there. Is this due to congregating inside with families, with parties, because of church? Why is this, or a combination of all of it?
Well, so what happens, is the virus isn't just sprinkled uniformly over the United States. It usually starts in bigger cities. It usually starts with travel or with however it gets there initially, and then it moves out from there. No place is spared from it. And we said that from, the beginning when all the other counties were like, we don't have to worry about this. That's a Chicago problem. We're like, no, that's not how pandemics work. It will be everywhere, and it will get in rural areas. So what's happened is it took longer to get to rural areas, but of course, now that it's there, you're seeing them doing zero mitigation almost, and it's just running wild because once it's there, and because some people were like, well, I was going to church and we never had any problems, right? Because COVID hadn't gotten into your church yet on someone, but once it does, and you are sitting inside unmasked with other people, you are absolutely going to have spread. And that's what we're seeing. The bars, the gatherings, people continue to meet and go out to dinner, meet and have little parties or gatherings in their house. And honestly, I'm really concerned about the number of people that are going to be hospitalized and the number of deaths we're going to see after the holidays, because people will gather. And no matter how many times we urge people to not gather, especially with older people or people that have underlying health conditions, it's still going to happen. We know it will. And then we're going to see the results of that. And I'm afraid it will be heartbreaking.
This weekend, I put my gym membership on hold because classes were full. A couple of members have been diagnosed with COVID. I walked in to pick up takeout from a local Mexican restaurant. The restaurant was packed, and you can't eat chips and salsa with a mask on. What will it take? And what are our numbers have to get to in order to move back a phase and have restaurants and gyms and things like that close?
Well, I'm not exactly sure, but if places are exceeding their capacity, they need to be closed right then. And we can't be, or not necessarily closed, but they need to mitigate. So if we went into some place and they were over capacity, and we knew about it, we would go in and we would tell them that half the people have to leave, or however many, to bring them into compliance. And they do that a couple of times, and then they're going to get fined. We just can't be everywhere at all times, and we require people to do the right thing. If you're a business, you need to do the right thing. And if you are people who are using businesses just like you did, that you don't go in there if somebody's not doing it right. But unless it's reported to us, we're not necessarily going to know about it.
All right, I'll have to text you later where I was and what happened. The U.S. is considering a national mask mandate if there is a change at the top with the presidency. The former USDA commissioner wrote an op-ed piece this weekend that we do need a mask mandate nationally. Are you there already that you think there should be one?
I believe that there should have been one in March. But the issue is it's been politicized for some bizarre reason. So it's, in Illinois, we have a mask mandate now. And if you leave Champaign-Urbana, you wouldn't know that there is one. In a lot of areas, it's just not being done. So it's one of those things where it should have been done early on, in my opinion. I mean, look at the places that really got on top of this fast and did it. They had the countries that had the mask mandates early, or places, like a lot of the Asian countries where they had already dealt with SARS. They didn't even need to be told by the government. They already knew. Of course, the government didn't say it, but they already knew. They've had the experience with it, and they understand that they work. In our country, we have gotten into this really bizarre belief that masks are somehow political, a political thing. And I don't think that that's going to change regardless of the election, regardless of what rules are put in the place. All we can hope is that we get more and more testing and more contact tracing and everything all over the country, because we're definitely headed in the wrong direction.
Let's say that we do see a spike and people do congregate for Thanksgiving and the things that you worry about, and for Christmas. Are the local facilities, the two hospitals we have here in our area, are they equipped now with adequate PPE and hospital beds and ventilators? Are we ready if we see a spike?
We're ready locally, yes, but everything is still finite. I mean, there's only so many doctors and only so many nurses and only so many respiratory therapists and only so many, so many employees. There's only so much out there. So we have to, and plus they're going to get very weary very quickly. You remember the scenes from, spring in New York. That's happening all over the place now. And there are tons of places that just don't have the capacity that we do. And I like to remind people too, that when you see on our CUPHD Facebook page, when you see that we have 7 hospitalized right now, that is only Champaign County residents. Right now, the hospitals have, I know one of them specifically has over 35 people with COVID right now. And again, it doesn't matter if you're in there and you're taking up a bed from COVID or flu or from whatever. There's only so many resources. And our catchment area for the hospitals, again, is way bigger than just Champaign County. So all of these surrounding counties that just do not seem to be on board with the mitigation and the prevention, they are also affecting our local hospitals.
Governor Pritzker says the spike in cases is in large part due to congregation in our houses, small groups, expanding our bubbles because we know people, it seems to be safe. How do we tell people not to congregate, or that it isn't safe? How do you have those conversations with family and friends that you would hope would have better sense?
Well, it's very difficult. I'm trying to talk to people now about, Thanksgiving and Christmas and planning, those type of events. It's hard to get them to understand that just because we're in the same family doesn't mean that we are able to gather safely. You're just not. we're seeing it over and over and over again. And usually when older people get infected, they're getting infected by family members and by gatherings. So that's something that nobody wants. Nobody wants that on their conscience, and you don't always know you have it. So it's not like somebody's going to the party or the birthday, the wedding, the funeral, whatever, sick necessarily. They might not even know they have it, and they're still able to transmit it. And even though they may get better quickly and be fine, it literally could lead to someone's death, and has. So it's just something that's you really have to think it through and decide, is that a risk I'm willing to take?
I have a scary statistic for you, Julie. More than a third of US children, 36%, did not get a flu shot during last year's flu season, according to the CDC. What are the guidelines from the CUPHD for who should get a flu shot age-wise?
Well, our guidelines are the same as the CDC, and that is everyone 6 months of age and older who is able to take a flu shot needs to take a flu shot, because they are protecting not only themselves, but they're protecting their families, they're protecting their communities. We don't know. It's the same thing with flu. Flu may be, flu is always miserable. There is no such thing as, flu not being miserable. It is very miserable. But some people will have very, very serious complications or death from flu. It happens every single year. So this year, more than ever, we need people to get their flu shots. Everyone, 6 months and up.
If the Supreme Court overturns the Affordable Care Act the day after the election, they're meeting on it, talk about the services that your office provides. People will not be left without dental. There are backups. What does CUPHD do in terms of healthcare?
Well, most of our stuff is prevention, and it's not so much going to affect our agency necessarily, but what it's going to affect is it's going to throw so many people off of having access to expanded Medicaid. It's going to throw people off. Well, what's one of the things the Affordable Care Act does, for example, is when you go to get preventative service, whether it's an immunization, a colonoscopy, a mammogram, any of those type of services, a pap test, those things you get without a copay. That was part of the Affordable Care Act. Before that, a colonoscopy locally, copay could be up, when you have good insurance, even could be up to $250. So what it does is it makes sure that people don't get preventative health care. So when they are finally diagnosed with something, it's often when the disease has progressed, when their chances of a positive outcome are diminished, and when it's very, very expensive and difficult to treat. So, I can't even hardly think about that, because it has done so much, and it just has. It has done so much to get access for people, and also to help to eliminate some health disparities. We're still not there yet, but it does help, and it definitely drives up more people getting preventative services, which in the long run saves a tremendous amount of money.
Julie Pryde, we will have several chances to talk before Thanksgiving to warn people and give them full amounts of information so they can make intelligent decisions. So thank you for your time today. I want to thank Urbana Mayor Diane Marlin. She is always out there in the community, making us feel safe, telling us how to do it. And Jason Liggett, you are amazing, our producer with UPTV. We always appreciate all of your efforts in making Julie and me sound somewhat coherent. So thank you for that. Julie Pryde, congratulations on your recent award. This community is lucky to have you. Thank you so much.